Hello, my name is Amy Mansue, and I have the honor and privilege to be the CEO of Inspira Health. And I am so pleased to be here today to talk about the amazing partnership that we have with the Gift of Life, the Organ Donation Center in Philadelphia. Rick Hasz is with us today. Rick, thank you so much for being here. I'm so excited about the chance to talk to you about this important topic. I know that you have spent your last 15 years in Philadelphia leading this program. I just thought you could talk a little bit about your background before we get into talking about our partnership.
Oh, sure. I started off as a research biologist at NIH.
Wow.
And one of my friends started working for the local organ procurement organization. And so this was almost 33 years ago. And I started there and worked as a transplant coordinator, working in the hospital and guiding families through donations.
So I shared with you already that I am an organ donor because I've seen it real time. My aunt was a recipient, and that waiting for that kidney was just so terrible and long. And you shared with me just some amazing statistics about not only the people who are waiting for the immediate, but those people who are going to be in need. Maybe you could talk about that a little bit.
Yeah, right now there's 100,000 patients in the United States, 5,000 in our local area who are awaiting transplant. You mentioned kidney transplant. The average waiting time right now is 5.5 years from the time that you're put on that waiting list. People with end-stage renal disease, there's over 500,000 people in the United States with, who are on dialysis, who 3 to 4 times a week are being tethered to a machine, and the mortality on dialysis is way too high. And so we need to envision a day where everyone who can be a donor decides to be a donor so that we can assist all of those patients.
So talk to me about how you talk to families that are trying to make those decisions for people who haven't made the decision right up front.
Sure. About 30% of the families that we talk to, their loved one had that donor designation on their license. And so that's incredibly powerful to be able to communicate that. But 70% of the time, their loved one didn't have that, and they're making that decision for them. And they're making that decision soon after hearing the news that their loved one had died. And so we have to do that in the most caring and sensitive manner. And it's really those days up until that, and us working with the critical care team to make sure that end-of-life decisions and end-of-life care is really maximized so that each family gets a tailored approach that's caring and sensitive to their circumstances.
Well, and that's really the issue, right? Is for any of us, is about anything really, right? Talking about it way before you actually are faced with it is a much easier conversation to have. Even if you haven't designated the organ donation, at least your family would know what you want. But then getting to that moment in time, it gives families I would imagine, such a sense of peace that they know they've honored their loved one's wishes.
Yeah, we know that when we asked in the Gallup polls, 90% of the public supports donation, and yet they don't tell their loved ones about that. So it's important to communicate that decision. Donor families routinely tell us how much donation has helped them in the grieving process. Recently was talking to a donor mom, Marquita Lewis, who donated her young son's organs. And she said that her son saved the lives of 3 individuals, but the gift of life really saved her because she's been able now to tell his story, create a new ending to that story that didn't have to be a tragic one, but could really be his legacy of being a hero and helping other people.
And imagine there's the comfort that gives her to know that he lives on in someone else. I mean, just such a peaceful way to be able to try and overcome such a tragedy.
Yeah, and words from donor families are really the stories that we like to tell. We know families who've said no to donation at the time, when we go to ask them 3 to 4 months later, a third of them wish they would have said yes. They just couldn't do it in that time. And so that just reinforces how much we have to have conversations around the dinner table, out in the public, about the importance of organ donation.
Well, I want to thank you so much because I know that it has been such a wonderful partnership that Inspira and the Gift of Life have shared together. We have a long, rich history of our time together in reference to being able to help people get to some of those decisions. And maybe you could give us a little bit about those statistics.
Last year alone, there were 14 organ donors. So far this year, there's been 10. over 29 lives saved, but also tissue donation, things such as skin, bone, corneas that are used in your ORs every day.
And we don't think about those things, right?
One tissue donor can help up to 100 people and
Wow.
save the lives for burn victims and give sight through cornea transplantation. It's an amazing gift that one donor can help over 100 different individuals. It's interesting, when most people have the opportunity to save a life, you know, maybe walking down the street and see an accident, people want to help.
Right.
And organ donation is an extension of that, and it's really a neighbor helping a neighbor.
Well, and I think we have misconceptions, right? You shared with me, I mean, I assumed that most of the transplants, or most of the organs rather, came from trauma, from an accident that somebody had, and that's, you know, that's where you get. But you said that no, it actually comes from different circumstances.
Yeah, I think that's one of the misnomers, in that donation is only after a car accident or trauma, and really it's only about 15–20% of the potential donors. The majority of patients have had a heart attack, their heart's been restarted, but the injury to the brain has caused them brain death. As we've expanded the donor pool, because there's so many people waiting, and trying to understand and increase the donor pool, even looking up at older age groups. Our oldest donor was 86 years of age.
Wow.
Who was able to donate their liver. And that liver is, you know, can regenerate and can provide that life for somebody who may die tomorrow. When we look at the driver's license statistics, we know there's a step-down progression. As you get older, less people select the donor designation. And a lot of people self-select. They think, well, I'm too old. They wouldn't want my organs.
Oh.
When in fact, that's the largest growing pool of potential donors, and that we really encourage everyone just to make that designation. Then we'll determine at the time with the transplant team what's going to be suitable at the time. And as we get more advances in medicine and things, we're able to expand that donor pool even more.
Well, there are two things that I know that we're especially grateful for. One is that we've started to model the recommendation that you all put forward to put our lights on at night in green when there's a donation that is going to happen. And so it tells the community and tells our staff that indeed we've had this, and it helps us support the team members. But the other is the one that I'm most grateful for, which is the letter we get afterwards that tells us from that person who we lost the impact that it's had. And I know when I get those letters and I share them with team members, it's just an amazing reaffirmation of the, you know, that the work is so critically important, and our work with you is so critically important.
Yeah, sometimes I think we're in the work of storytelling,
Yep.
and it's so important to tell that donor family story, but also the story of who's benefited, and getting that feedback back to the staff who's participated, because all they can sometimes remember is the grief and the loss that they've had to deal with in front of them, and they don't ever get to necessarily meet the recipients. And so if we can tell those stories in different ways, whether it's through a letter or now social media, we've begun doing these things called donation ovations, where we videotape donor families or recipients to say thank you, and we send it back to the staff.
Oh, wow.
Really to connect them to that purpose.
It really is important for people to know that Philadelphia, South Jersey region does lead the nation.
For us, it's really about that partnership. You know, why we've led the country for the last 15 years, it's because of the community who said yes to donation. It's been about the healthcare providers who've been able to really implement some of the best practices around donation and transplantation. And then it's the teamwork. And donation and transplant, like anything else in healthcare, it's really a team endeavor. And we're really proud of that partnership as well.
How does an organ get from one place to another? Like, how do you decide?
For every donor, we run a list coming out of the national system of the patients who are awaiting transplantation. And it draws a circle, a 250 nautical mile circle, around where the donor hospital is. And it's those patients who are in that area are the first to get that opportunity. And then it ranks them by how sick they are.
Right.
And when a donor becomes available, our staff is working with your teams to manage that donor, to evaluate each and every organ, to allocate those organs to the specific patients, and then arrange for all the transportation and get the organ from point A to point B after we recover it. We're in a supply and demand imbalance, and
Yep.
so we really have to make sure that we're doing it in the best possible way that's most fair and best utilizes that gift and hopefully provides more years for that transplant recipient.
So I know that people are watching are asking, okay, well, how can I help? And I think the easy answer is the first thing you can do, is check the box,
Yep.
right? Check the box on your license, make sure you do that. But what else would you say to people? What else can they do?
Besides checking the box, talk to your family, talk to your loved ones, let them know, because it's so much easier for them during that process if they really knew what your wishes are. And your driver's license is the best way to do that. You can go to our website at donors1.org and register to be a donor there. We always say it takes 30 seconds to register to be a donor, but that 30 seconds can mean a lifetime for somebody else. And it's a simple act. It's easy.
Right, it is easy, right? It has world-changing implications for people, but it's an easy thing to do.
Yeah.
It's just about the education and also just helping people. I think today one of the big messages we've learned is don't ever think you're too old.
Yeah.
I mean, because obviously there's opportunity for us to continue this great work, and the medical science has allowed us to really redefine that, which I think we should all be so very proud of.
Yeah, if you ask a transplant surgeon today, what's the biggest rate limiting factor on donation and transplant? It's not the immunosuppressive drugs. Not that we've solved it perfectly, but we've gotten so much better. It's not the surgical technique. It's really about people saying yes to donation. That's
Wow.
the biggest rate limiting step. So the more we can tell the stories of those families who've benefited, tell the stories of the donor families who've also benefited and how that's impacted their grieving process, I think that's the most important message we can have.
And to those 500,000 people, the 100,000 that are waiting and the 500,000 that are with end-stage renal, that we're doing everything we can to figure out a way to make sure we share the message and get them what they desperately need.
I think that'll provide a lot of hope for those patients.
Absolutely. Well, thank you so much for coming today, Rick. We are so very grateful for the partnership. And to all of you, we certainly thank you for your continued commitment to our community. We please ask you to make sure you think about, if you haven't done so already, check in that box. Just as Rick said, 130 seconds can really change the life of everybody. Until we meet again, be well and stay safe.